Welcome everyone to 10 Things Parents Need to Know About Why We Immunize. We appreciate your time today. Thank you for spending your lunch hour with us, learning about how to talk to parents about vaccines. We are thrilled to see so many people joining. I see a few raised hands. Just if you want to unmute and ask your question, feel free to. Or ask your question in the chat box. We have many people joining us today from all counties in Arizona. So I was so happy to see on the registration list, we have a lot from Maricopa County, Pima County, of course, but then there was a lot from Pinal and Yuma counties with us today. So that is great. Thank you for signing up. Thank you for wanting to learn more about how to talk to parents about vaccines. We also have many medical assistants, vaccine coordinators, public health nurses, and community health workers. So a lot of people doing the same jobs as each other. So it's great that you are here. We are going to heavily use the chat box today. If you have any questions, if you have any comments, if you've heard some of these questions before, feel free to chime in and answer them. One important thing is, if you are watching the training with someone else in the room, like you're watching on the same screen, please put their name in the chat box so they get credit for attending also today. Thank you to Central Arizona Area Health Education Center for running this today and offering the CEU credits. We really appreciate their help. And just as a note, you do need to be attending live today to receive those CEU credits. Okay, let's go to the next slide. Just a few reminders. Please keep your microphone on mute unless you are speaking. You can use the chat box to ask questions, as I said. All of the handouts and videos will be available to you after the training today. So don't feel like you have to write everything down. We will definitely send you the links and a copy of the slides, all of that for today. Just a disclosure, we, as presenters, we don't have any financial interest or relationship with the commercial supporter of this educational activity. And today we're going to talk about why we immunize. So I'm going to, my name's Laura Smith. I'm the program manager of community education. I have a bachelor's of public health, and I'm a certified health education specialist. And presenting with me today is Wendy. Wendy, do you want to introduce yourself?
Sure. Hi. Yeah, my name is Wendy O'Donnell. I also have a background in public health, specifically health education, a lot of immunization education. So I'm super excited to be here. I'm also a parent. So although this is my chosen career path, it's also what I'm passionate about, just to keep my own family safe and my community safe. I'm so glad to see so many people from Yuma. I'm from the Yuma area, so welcome.
That's great. Thank you, Wendy. Okay, so the objectives of the training today, we're going to discuss 10 science-centered, evidence-based concepts about why parents should vaccinate their children. We'll also answer common questions, address myths or misconceptions that you may have heard about vaccines. And then we also want to provide you credible vaccine online resources, so then you can give them to the parents that you are working with and just have that support that you need after the training today. So the goal of this whole training is to help you, social workers, teachers, health educators, medical assistants, become more knowledgeable about vaccine benefits, and that will help the parents that you work with make a more informed decision on their intent to vaccinate their children. We will have some quizzes throughout the training today, so make sure that you feel familiar with the chat box so you can give the answer and hopefully win a prize. Okay, I want to show this quick video about some things we have learned through vaccination.
I want to tell you about a
time in American history so that
it never repeats itself.
So it never repeats itself. It was a harrowing time.
a heart-wrenching time. I could hear my mother warn me, Seal, don't go out and play.
My family was ravaged.
Thousands and thousands died.
I was scared.
So scared.
And then one day,
And then one day, there was hope.
Before vaccines, there were few ways to help protect against deadly illnesses. Diseases like measles,
Meningitis.
diphtheria,
Hib,
Whooping cough.
or polio, which killed my grandma's youngest son. Without vaccines, these threats can reemerge.
I'm here.
I'm here.
I'm here to tell my children to help protect their children.
Get your kids vaccinated and keep them on schedule.
I never want my grandchildren to see what I saw.
The real dilemma that we have to face is that because vaccines have been so effective over the past 50 to 75 years, many people have forgotten about the diseases that those vaccines were developed to fight. We don't often see polio or some of the other ones that they mentioned in the video, but when we forget about the diseases that vaccines prevent, it's called there's a phenomenon called vaccine amnesia or public health amnesia, where a public health initiative such as vaccines becomes so effective that people forget how bad it once was. And then we can see things like measles cases start to pop up more and more across the country. This map shows exactly what we're talking about with that public health amnesia. So measles was thought to be eradicated in the year 2000, but in 2014, new cases started popping up in unvaccinated communities. And still later, we see that in 2019, all of the states in dark blue, including Arizona, reported at least one case of measles. So that's a lot across the country, more than half, from a disease that we believed was eradicated. The problem persists. These outbreaks are a direct effect of low immunization rates. And this shows that even when we haven't seen a single case of a disease in 14 years, it does not mean that it has gone away. Continued immunization is the only way to prevent these diseases long term. So we want to just remind you that kids are still at risk for disease, especially Arizona kids. So the Arizona Department of Health Services requires every school to report once a year on coverage levels of kids enrolled in schools. So this information is made available to the public and parents can be informed about coverage levels. Across Arizona, our schools used to be around 95% coverage rate, but over the last 5 to 6 years, the level of protection has begun to drop as the number of vaccine exemptions have begun to increase. So in Arizona, there are some schools that have only a 40% coverage rate of immunizations. Arizona has been identified as a hotspot because of low coverage levels. Thing number 2, vaccine preventable diseases still exist. The data shows that these diseases still exist and are circulating. However, I could argue that if you've never experienced some of these diseases, you can fall into the trap of believing that these diseases no longer exist or are relevant, or probably will never touch you personally. I want to show you a video. It's very difficult to watch, and I'm going to have you watch the whole thing just to get the effect, because it's a very important problem that is happening right now. So this cute little baby, here we go.
It's just kind of heavy. Uh-oh. There we go. okay. Take a breath in, honey. Come on. Almost there. There we go. Oh my. It's okay. It's okay. Yeah. It's okay. Here. Yeah. It's okay. Yeah. It's okay, sweetie. Yeah. Right. It's okay. It's okay. Yeah. It's okay. Yeah. I know. Yes. Oh, I know. It's okay.
The video is so difficult to watch. This baby has pertussis or whooping cough, and she was too young to get immunized against this. They have to be older. And unfortunately was exposed to it and developed whooping cough. So it is so sad to hear her struggling for breath and crying. It's a hard movie to watch, and I've seen it many times, and it still is so difficult to see that that this baby has this disease. And then the man on the right, he has mumps. You can see his face is all swollen. So these diseases still exist. They are out there, and in fact, lots of people in the US every single year. Okay, our first trivia question. The US had cases of which of these vaccine preventable diseases in the year 2022? A is polio, B, measles, C, pertussis, D is none of those diseases, or E is all of the above. You can put your answer in the chat box, and then we have Denise monitoring the chat today. She'll be answering any questions that you have in there, and also giving out some prizes. So put your answer in the chat and she will contact you. We'll give you just another few seconds. Okay, overwhelmingly, you all know that it is E, all of the above. The US did have many cases of polio, measles, and pertussis last year, and Arizona had a very high rate of pertussis last year. So Denise will contact you for if you won a prize. And if you didn't win, we still have a few more trivia questions coming up, so don't worry about that. Okay, number 3, outbreaks are preventable when parents make the decision to vaccinate. So the way we have traditionally prevented outbreaks was to keep 95% of the population immunized against a specific disease, or all of them. If 95% of people have immunity, the disease cannot spread through the community. It's really important that our youngest kids are immunized before entering school to protect the community around them. You may have heard of the term herd immunity or community immunity. So that is when we are attempting to keep our communities healthy, and the best way to do that is to vaccinate. I think it's easiest to think about community immunity in terms of a fence. So if you think about those of us with immunizations kind of as the planks around the fence, and together, if 95% of us are immunized, we can be all of those planks, and we can, if someone is not able to get immunized, either a young child or an older adult or someone who's immunocompromised, they are protected by the fence around them. So when a disease comes up, it hits the fence, and those unimmunized people will not get sick or be able to spread the disease. And so how outbreaks happen is when there are too many holes in the fence, there's not 95% of people protecting those inside, and the disease just kind of floats right through. So once it infects an unimmunized person, it puts all the other unimmunized people at risk. We know that vaccines work. They are studied. We have hard evidence to show that they work. Once we have a vaccine against a disease, we have been able to eradicate, eliminate, or decrease the number of cases to almost zero. So the chart may be a little bit small based on how you are watching the training today. If it's on your phone, it might be very small, but I just wanted to go through this real quick. So you can see that smallpox was eradicated in 1980, and it decreased by 100%. That means that's why it's eradicated. Diphtheria, the last outbreak was in the 1970s. That decreased by 99.9%. And then you can kind of go through and look at the different diseases. So these are all vaccines that our kids get when they are little, and we keep the community immunized. Vaccines save an estimated 42,000 lives every single year in the US alone, which is 3 times more than seatbelts and child restraints combined. So think about that for just a minute. Choosing not to vaccinate your child is like putting them in a car with no seatbelt or child restraint. Now, I know when I was a little kid, seatbelts were not as heavily enforced. But if you think about now, would I go and put my baby in the car and not put them in their car seat and buckle them up and make sure everything's perfect and then drive around? I wouldn't do that. Sometimes, most of the time, if we don't use a seatbelt, maybe it would be okay, because statistically, how often do you get into a car accident? Maybe you're only driving a few miles. But, it only takes a single incident for a seatbelt or child restraint to be worthwhile in saving your child's life. That's why we do it every time, right? And just like that, it only takes a single exposure to a disease that you can't see for your child to become ill with one of these diseases. And the long-term effects on their health can be very serious if they survive. Just like that baby that we saw in there. It's real, you can't see that pertussis coming at them, but they get sick anyway. Number 5, vaccines offer protection to us, and sometimes in different ways. So newborns, they are too young to get vaccinated. They are protected by their mother's vaccines, and this is their very first protection, but it does begin to wear off around 2 months of age. And that's why there's a schedule that starts when the baby's 2 months old to continue this protection throughout their life. Also, some people cannot get vaccines. They are too sick or they have allergies. These people are protected by those around them from getting vaccinated, just like our fence analogy. Let's see. So I had a baby in January 2021. She's 2 now. And this was at the height of flu season, COVID season, RSV. It was very, in the middle of a pandemic, a very scary time to actually have a baby. So I have older kids that are in school, and I told them, our baby cannot get, she cannot be protected against the flu. So what we need to do as a family is we need to get our flu shots and protect her because she is too young to get one. So we all got our flu shots. And we, tried to do our best to create that herd immunity around our baby. The COVID vaccine was not available when I was pregnant, but I was able to get vaccinated shortly after that and also protect the baby against COVID also. So getting shots offer protection that will help your child's immune system fight when they are exposed to diseases. Okay, so Wendy, my co-presenter, it is your turn. Let's hear about some more reasons.
Yes, and actually, just like Laura, I was pregnant in 2021. My baby was born in May, so I had the added peace of mind to actually get vaccinated while I was pregnant. So Laura didn't have that safety net because it wasn't yet available, but I was lucky enough to time it correctly and felt a little bit better that he had at least a little bit of protection when he was born. Because again, yeah, like Laura said, I have older kids as well. And we all know that they just love to bring home everything from school. So that helped tremendously. So now I want to go. So number 6, vaccine antibodies act as personal ninjas to protect from the actual disease. So after someone actually gets the disease, it can take several months to years for their immune system to fully recover, leaving them vulnerable to other illnesses and diseases. So it's better to get the vaccine, which acts much quicker. The vaccine tells your body that it needs to equip itself against this disease before you're ever exposed to it. And your body in response creates a bunch of antibodies that are like ninjas, just waiting to fight off an exposure. Many years ago, when the vaccines were developed, they had a lot more antigens in them to protect against the disease. But now vaccines have been refined and updated to reduce the amount of antigens needed to protect against the disease. All of the research on safety and efficiency makes it possible for vaccine developers to make sure that they're getting better and better all of the time. So you can see a lot of people say that they, babies are getting too many shots. So what we can show them now is that actually their exposure to antigens is a lot lower, and they're getting a higher level of protection. So I like that little graphic, and that's a good one to use when people have questions like that. So we have another question. What vaccine is recommended during pregnancy? Is it A, pertussis, B, flu, C, COVID, D, B and C, or E, all of the above? Go ahead and have your answers flowing in. It's great. Well, this is great. It looks like the majority of what I'm seeing is E, and that is correct. It's pertussis, flu, and COVID. So that's really great. Looks like most of you have gotten that message. These are all illnesses that would be especially harmful for babies if they got in those first 2 months of life, so they get a little bit more protection from getting it when mom's pregnant. And that leads us right to 7. Babies get their first vaccine from mom. So we've kind of mentioned that a few times. There are new recommendations focused on pregnant mothers that during every pregnancy, the mother get a flu, pertussis, and COVID vaccine to protect her and her baby. It's important to talk to your OBGYN or have your parents talk to their OBGYNs about when and where to get these important vaccines. The timing, the timing is important. And also many people have all of their members of the household and anyone who's going to be close to that new baby get immunized against these as well. I know that I had my parents, my sister, everyone who was going to be close, my husband, get the Tdap vaccine when I was pregnant. with each pregnancy, just to make sure that their protection was up to date. And of course, the flu. I have two babies born in flu season as well, so that's scary, and it's really nice to have that added protection. And as Laura mentioned, this is your baby's first line of defense, and they're really their protection until they're 2 months old and can start getting their vaccines as well. And fight the flu. We've had a really interesting flu season this year. If you all are following the news, the best defense against the flu is the flu shot. The precautions that we talk about with COVID also help with the flu. So it's really nice. They're universal precautions. It helps with a lot of things. But without vaccination, you can get a lot more sick if you do get infected. If you do get the flu or believe you have flu-like symptoms, please talk to your doctor about being tested for the flu or for COVID, and the possibility of antiviral therapy if it is the flu. Sometimes you hear people say that the flu shot always makes them sick, so they don't like getting it. However, it's important to know that symptoms you might experience after getting a vaccine are actually a good thing. A low-grade fever, body aches, or even fatigue are all signs that your body has accepted the vaccine and it's doing what it's supposed to do. So it's having an immune response. It's helped building that protection, and you're developing immunity. Okay, we've got another trivia question. Can someone get a flu vaccine and COVID vaccine in the same visit? Is it yes, no, or not sure? Love those answers coming in. Thank you so much for participating. Great. Well, this is another one. Seems like you guys are right on it. Yes, the answer is yes. It's really nice to see that. I think in several months ago when we did this presentation, a lot of people weren't sure. So it's great that the message is getting out there, and people are learning this because it's a great time. If you're there getting your flu shot, might as well get your COVID as well. It's nice. It's a one-stop shop, and the symptoms or the side effects can be pretty manageable, and they're not heightened by getting both at the same time. Number 8, doctors and science support vaccination. This is one that's super important, I think, especially now with all the news, all the alternative news that you see that's out there. The American Academy of Pediatrics, the American Academy of Family Physicians, American College of Obstetricians and Gynecologists, American Nurses Association, the Centers for Disease Control and Prevention, the March and Dives. These are just a few of the most well-known, but all of these organizations strongly support immunization as a strategy to keep kids healthy. It's important to trust your healthcare provider. Their education, knowledge, and experience is what you can rely on if you have questions. They're also a great place to send parents if you get stuck on a question they have about vaccines. So you'll notice too that most overwhelmingly, when you go to see your provider, they're all in support of immunization as well. So they're a great resource for you, for the families that you work with. And then number 9, off to school and equals up to date on shots. It's important for children to be up to date on shots because when they enter the classroom, they're in close contact with many other children where diseases can spread rapidly. If you have school-age children, you know this. I'm pretty sure my household was sick all of last semester. So you don't want your child sick or bringing home a preventable disease that may expose a younger sibling or older adult, grandparents that are perhaps under-immunized. Each state has their own requirement in terms of school entry and vaccines, so try to get familiar with the guidelines in your state. The CDC website has information for all 50 states if you're unsure about your specific requirements. This is also where you will hear recommended versus required. A lot of times the required school immunizations are what Arizona, which has been, set by the lawmakers of the state, that's what they've chosen to put to require for school entry. The CDC recommended schedule is what is recommended to have. It's the optimal recommendation to keep kids healthy and keep disease from spreading. So people think that required is more important than recommended, but in this case, it is not. And you always want to go with the CDC recommended schedule. And then number 10, kids still need protection as they grow. And we talk a lot about baby shots. We know that they get a lot when they're very little, but the same recommendations for vaccines continue throughout their life. We recommend following the CDC schedule again for immunizations. The schedules are updated with new and improved vaccines as they come out. And you can go to the CDC website to review the recommendations for yourself. They even have a printable vaccine schedule that's easy to read for your reference. And TAPI actually has a really great resource as well that's a family flyer, and it's through the lifespan, the youngest, newborns, up to grandparents. That's one schedule for the whole family that's really nice and easy to read, and it talks about when the different immunizations are recommended at what age ranges and things like that. So it's really great. I suggest using that. Okay.
Okay, so next we're going to watch a great video that talks about why vaccines work. It's a little bit long, it's about 7 minutes, but it's a really good foundation for your understanding about why vaccines work. Think about any questions that you have as we watch the video, and then we can go through any questions that we receive. So here we go.
Aren't you glad you don't have scurvy? In 1747, in the first medical trial ever performed, Scottish physician James Lind found out that eating citrus fruits could cure scurvy. Now, today we know this works because citrus contains high levels of vitamin C. In fact, ascorbic acid, a common name for vitamin C, comes from the Latin for not scurvy. By issuing rations of lemon juice to sailors, the British Navy was able to pretty much eliminate the disease until the late 1800s, when polar explorers suddenly began to see scurvy again. The copper pots holding their lime juice had destroyed the vitamin C, but they were pretty confused. So despite James Lind's experiments 150 years before, citrus fruits became the enemy. And when Robert Falcon Scott set out to reach the South Pole in 1911, he carried the finest in canned meat products, biscuits, chocolate, tea, and zero vitamin C. A Norwegian team beat them to the pole by 5 weeks, and during their sad journey home, Scott and his team perished in a blizzard, sick and weak from what was probably scurvy. It had been so long since anyone had seen this disease, the British had forgotten how to prevent it. When we create such effective solutions, we can forget how serious the problems were. Thankfully, people today don't die of scurvy or polio. Since the introduction of Jonas Salk's polio vaccine in 1955, the disease has been nearly eradicated from the earth.
The thing to remember is that this is a continuous process.
Compare the 358 infections reported in 2014 to the 1940s, when 500,000 people per year were paralyzed or died from polio infections. Vaccines work. Our immune system is on constant alert against germy baddies, with millions of white blood cells each on the lookout for specific infections. When an immune cell meets its target, it replicates itself, and this clone army sends a barrage of protein weapons called antibodies to label the trash for cleanup. And after the infection is gone, so-called memory cells stick around, ready to mount a fast attack in case this germ shows up again. This is how we develop immunity, and it works pretty well, since we're all still alive. But even with all that, some super bad germs can take us out before our immune sentries have had time to call up their clone army. This is especially true for young children. Their immune systems are fresh out of basic training. Thankfully, we have vaccines, which are made of tiny pieces or weakened versions of viruses or bacteria. They let our immune system see what the bad guys look like and recruit those all-important memory cells before we ever have to actually see the real enemy. Thanks to vaccines, the US was able to eliminate measles in the year 2000. But in recent years, as more and more parents are refusing to vaccinate their children or are vaccinating them later than what doctors recommend, it's back. In most states, more than 90% of children are vaccinated, but that's not enough to keep a disease like measles at bay. In our episode about Ebola, we talked about a number called R0, the basic reproduction number for a disease, or the number of people infected by one person in a susceptible population. For Ebola, that number is low, but for measles, each sick person will infect up to 18 others. Well, luckily, vaccines can change that. The fraction of people who are vaccinated or immune can lower the reproduction number below 1, which means the disease is disappearing. 90% of unprotected people who come in contact with somebody who has measles, even just breathing the same air, will become infected. To control a super contagious virus like that, the vaccination rate has to be 95% or above. And right now the US is lagging behind, and measles is making a comeback. The Guardian put together a simulation of just how this so-called herd immunity works. When enough of a population is vaccinated, even if it's not 100%, the herd can protect the unprotected. With vaccine refusal on the rise, our herd immunity is breaking down. Preventable diseases like measles and whooping cough have become our scurvy. Most of us don't know anyone with polio, and I mean, measles. It's not that bad, right? Well, yes, it is that bad. Before the age of vaccines, millions of people were killed by diseases that today are just bad memories. Vaccines have let us develop a sort of generational amnesia. Today we expect our children to grow up healthy, and we're lucky that we don't appreciate just how dangerous these diseases are. Like science writer Seth Mnookin says, vaccines are victims of their own success. Because of stories like Andrew Wakefield's discredited study wrongly linking vaccines and autism, and the news media's obsession with pictures of crying, terrified children being poked with needles, people are nervous about vaccines. This anxiety isn't new, though. When Edward Jenner in 1798 saw that milkmaids didn't catch smallpox, well, he realized that because they'd been exposed to the similar cowpox disease, they were immune. And based on this, he developed an early smallpox vaccine by inoculating humans with the cow virus. In fact, the word vaccine itself has bovine origins. Still, as far back as 1802, critics were claiming that the smallpox inoculation would turn you into a cow. Vaccines don't come without risk. Nothing does. But on average, fewer than 1 in a million people will experience a dangerous reaction to common vaccines. And car accidents, playing outside, even walking will injure more children. Vaccines are asking us to do something altruistic, to make a choice to protect not only ourselves and our children, but also those around us. Author Eula Biss says that vaccines are one of the most empathetic things that we can do. A system that's based on people voluntarily using their bodies to protect other vulnerable people. And that's something I hope we don't forget. Now, I'm a doctor, but I'm not that kind of doctor. It's natural to have questions about vaccines, and you should have a conversation with your medical professional. They want the best for you and yours. I will give you one prescription though, and that's to subscribe so you can get a full dose of science every week.
Okay, well, hopefully you learned something from this video. I do want to just pause for just a minute. And do you have any questions about the video? Anything we can answer real quick? Please put it in the chat box and we would love to answer it. Or any general vaccine questions. We'll give you just a minute if you wanted to type something in. Thank you, Elizabeth. She said, one thing I've heard hesitant parents say is that sure, there were lots of deaths in the past from diphtheria and measles and mumps, but with our current medical treatments and supportive care abilities, we are much better than before when they were so deadly. So it kind of wouldn't be as bad if their kid got diseases now. So Elizabeth, I am not sure of your profession, but you're public health something if you're here today. So how do you answer that? Like, what do you say? Oh, okay. Pediatric nurse. So what do you say to that parent? And if anyone else would like to kind of take a stab at figuring out how they would answer that, I would love to hear what you have to say. Is it not so bad that if their kid got the disease now? Okay, that's a great answer. We do have supportive care, but if vaccinated, they wouldn't have had the child suffer in the first place. Nobody wants to have their child suffer, right? Like, we don't want to see them have sometimes long-lasting effects from these preventable diseases, including death. There are still children that die from preventable diseases. So that's a great answer. Sounds like you have a lot of experience. Yes, Christine says you can't guarantee the outcomes. That is true. Yes. Okay. Great point, Britley. I would say something along the lines of, yes, their kids may get it, but they may infect someone else who may be immunosuppressed, or the elderly that wouldn't do well. Yeah, I mean, we definitely saw that with when we were waiting for the COVID vaccine to come through. There was a lot of people that could have really been saved by getting vaccinated. So that's great. Thank you so much for your feedback. We all learned from each other, and I think it's really helpful to hear how you all answer these different questions. So that is great. Does anyone else have any other questions or something that they hear a lot? Okay, Adriana, we are talking about how vaccines, we've heard that before, parents hear that, but that vaccines are linked to autism, and we know now that they are not. So we will talk about that in just a few minutes. Denise always is so great. Yes, that's a great response. Does a baby with little or no immune system can have a good response to vaccines? Guadalupe, that's a great question. Yeah, so, we saw in the chart before the different vaccines that babies get and how those diseases are eradicated. So yes, a baby with little or no immune system, they can definitely have a good response to vaccines. Now, if they are immunocompromised, if they have some other medical issue besides just being a baby, you definitely need to talk with your medical provider to make sure that they are able to get vaccinated and what would work best for them. But in general, a general healthy baby, yes, they can have a very good response to being vaccinated. Okay, let's move on, and feel free to continue those questions and we will try to answer them as they come in.
And if you want to read some...
Okay, sorry. Okay, so Wendy, talk to us about COVID vaccines.
Sure. So this is, of course, very important information. We have so much research and information on the recommended childhood vaccine schedule, and this is one that people are kind of questioning and wondering how we could have all of this information so fast and get this vaccine out when other ones took years and years and years. So one thing that should put your mind at ease is that the safety of the COVID-19 vaccine is top priority. Full safety trials were done on each of on all the vaccines, and our ongoing monitoring continues. Pfizer and Moderna COVID-19 vaccines are recommended for everyone 6 months and older. And everything we learned about how vaccines are developed, the monitoring, the reasoning behind vaccines apply to the COVID vaccines as well. Full safety trials were done, and ongoing monitoring continues. We're always collecting data and making sure that what we have is the most, it has the best response and has the fewest side effects. Children weren't among the first to get the vaccine because clinical trials did not include children. However, as the vaccine proved to be safe in adults, additional trials included children. And now families around the world can celebrate because children 6 months and older can receive the COVID-19 vaccine. I know it was a big day in my family when we could go and take my little ones to get the COVID vaccine. It is safe to get their usual vaccines with the COVID-19 vaccine as well. So if you are, or if you're working with a family who's going to take their child in to get the COVID vaccine, make sure that they're checking that they're up to date with all of the other recommended vaccines for their age. Vaccinated kids protect other kids in the classroom and the family. And there's also different recommendations for kids who get COVID if they are in school. If they're vaccinated, if they've been exposed, they don't have to quarantine. So they'd be able to stay in their regular activities and their day-to-day school and all of the things that make, that make being a kid so fun. Let's see. So one thing people talk all the time about, like, oh, it's not that bad for kids. They just get sick and, they might get a little sick and a lot of them don't even feel bad at all. And that's great. I'm so happy for those kids that they're not feeling bad. But it's really important to remember that there have been over 15.3 million cases of COVID-19 in children since the beginning of the pandemic, and over 1,600 deaths. So 1,633 deaths in children. That's huge. To those, 1,633 families, that completely changed their lives. And those kids are no longer with us. So it's happening, and it's important to know, especially when there is something you can do to help equip yourself and your community and your family, and to have a better response and to prevent this. That's really important to know, to do your part. And now this is really great. Bivalent boosters are available for everyone ages 6 months and up. COVID vaccines have targeted the original COVID-19 strain. That's kind of how it has been since the beginning of the pandemic. But we know there have been variants since the very beginning, and it kind of made the vaccines a little bit less effective. So they have created a new bivalent vaccine, which provides protection against both the original strain and the new Omicron strain. So it offers your body the best protection against the circulating COVID-19 disease that's out there now.
If you need to know where to find a COVID-19 vaccine, TAPI has a COVID vaccine finder. It's free, it's easy to use. You just type in your address and you can find locations near you. You can sort by different types of COVID vaccines, different ages. Denise will put this link in the chat so you can kind of look it up. I have used this TAPI COVID vaccine finder many times as we have been keeping up to date on our COVID boosters and with our different aged kids. So it is very easy to use and a great resource to give to parents if they are looking to figure out where they could get vaccinated also. Just an important note. If you work with people, with parents of young kids, you work with kids, I know we saw the pediatric nurse, please make sure that you yourself are immunized against flu and COVID. And so then you can stay healthy and continue to serve Arizona families. The COVID vaccine is widely available. And if you need to know, if you can't find anything on our TAPI vaccine finder, you can also contact your county health department and they can let you know where you can get vaccinated. But you don't want to spread that to the families and children that you're working with. So make sure that you keep yourself protected and you stay healthy, because we need all of you out there doing your job every single day and helping Arizona kids and families. Okay, so here, this part of the presentation, we're going to talk about some common topics that we hear about a lot, but I also wanted to know what are hard to answer questions that you hear on a, in your job, in your communities, whether, that's at work or in your family. What kind of questions do you hear that you just aren't quite sure how to answer? As we saw earlier, someone asked a question and then other people kind of chimed in with their ideas of how they would answer that. Does anyone have any, like, what's the hardest vaccine question that you've heard or the craziest question that you've heard? We would love to, kind of hear what's going on in the community out there. We have people from all around the state, so we know it's different depending on where you live. So let us know if there's anything. Looks like Denise is doing a great job keeping up with questions in the chat, but if there's anything else, feel free to put them in there and we would love to hear them. When you answer questions that you do get, I just wanted to remind you that, using your own experiences to think about how you would talk to parents or encourage them to vaccinate, you're a trusted professional. They want to hear your opinion and they value your opinion. And it's just, you're in a very great spot to be able to help all the people that you work with. Let's see. When a parent wants to know every single ingredient in the vaccines, and if the provider or whoever can't answer it, they don't trust and will say, how can we recommend it when we don't even know what's in it? That is such a good question. Okay. Nicole, and 100% accurate. And then you have to explain it in Spanish. Yes, that is tricky. So every vaccine does have the package insert that it comes with. Also, the CDC is a great resource to with handouts for different vaccines and answers a lot of questions that way. If there's a specific vaccine that they're wondering about, I would definitely, if you're giving vaccines in your office, you probably have those, the information sheets that you give out with them. So I would make sure to have plenty of those. And then also educate yourself to kind of say, if you're hearing these questions over and over again, make sure that you have some resources about the different vaccines that you're getting questions about.
Laura, I just wanted to add,
yeah,
that would be a good time to remind people about the safety monitoring. So maybe you do, I don't know all the ingredients of all the food that I eat, you know what I mean? And it is monitored through the FDA, but then the vaccines are monitored as well. So we know that if there's an ingredient that they find is having an unintended effect on somebody or, on a population, and they can tie it to that ingredient, then they will change the formula and make it safe. So that's I think anytime we can talk about safety and that we're constantly monitoring that safety and following these vaccines, it's a good thing just to remind people.
Excellent point, Wendy. That's great. I see a question from Julia in here. Why would I give my teen an HPV vaccine if he is not sexually active? Well, if that parent someday wants to have grandkids, they will understand that at some point in their life, their child will become sexually active. And it is really important to protect them against every disease possible. I have 2 teenage boys right now, and we did not have the sex talk in regards to the HPV vaccine. We did not say this is a vaccine that you can take so you can have sex. We did not say that at all. What I said to them is this vaccine you're getting today prevents many different kinds of cancers. And my kids were like, really? That's great. Okay, let's get it. So instead of focusing HPV on a sexually transmitted disease infection, focus it on that is an amazing vaccine to prevent cancer. You just never know what will happen down the road, and you need to protect as a child to make sure that they do not develop any of those cancers associated with HPV. Let's see, a lot of questions coming in. Thank you so much. This is great. Lots of answers coming in. Okay, we are, let's see, trying to read through them. I'm going to let Denise answer a bunch of these as we continue. The CDC's Pink Book, if they really want to know every single ingredient. I did have one mother. So Elizabeth, it sounds like you have the CDC Pink Book. Tappy does have these, and we are willing and able to send you a Pink Book for your office. So if you would like a Pink Book, please contact me. My contact information has been all over the registration and emails, and we will send you a Pink Book so you can have that. Okay, let's keep going. I'll let Denise keep going also. So thank you so much. All right, so now we have a few little case scenarios. So if this happened, how would you answer it and what resources would you provide? So here's a situation. A couple that you are friends with tell you that they worry newer vaccines are not safe. So we talked about safety of a vaccine just a minute ago. They worry that the pharmaceutical companies make vaccines without testing them before they are given to kids and adults. So what resources do you have available to help them with their concerns? So before a new vaccine is ever given, extensive lab testing is done. Once testing in people begins, it can take several more years. This was all advanced a lot during COVID. There was a lot of money and collaboration, and people, different organizations came together to push through this vaccine. But it usually takes a very long time before clinical trials are completed and vaccine is licensed. So, and then once the vaccine is developed and deemed safe, then it is continually monitored. Even after the public starts to use it, they continue to do those safety trials. They don't just say, okay, that's it. They continue to monitor it and watch for any possible side effects. So there's a short video about this, and it's kind of a lot of information, but I think it'll be helpful in our discussion here.
The journey of your child's vaccine. A vaccine must be safe and effective. How a new vaccine is developed, approved, and manufactured. Vaccines begin the journey in the laboratory, where scientists work to figure out how best to protect against dangerous germs. Before a new vaccine is made available to the public, researchers usually must do years of lab tests on the vaccine. If lab results look promising and the vaccine appears to be both safe and effective, volunteers will be enrolled to get the vaccines in a series of carefully monitored clinical trials. The manufacturer usually conducts 3 phases of clinical trials. Each phase is designed to gather more information about the vaccine's safety and how well it works. These trials can take years to complete. During phase 1, about 20 to 100 healthy adults get the vaccine. Researchers track how well the vaccine works, whether it's safe, what is the correct dose for disease protection, and what possible serious side effects may occur. In phase 2, hundreds of volunteers participate. This is when experts learn more about the possible short-term side effects and how the volunteers' immune systems are responding. Phase 3 trials are the most informative, with results from hundreds or even thousands of volunteers. In these trials, vaccinated volunteers are compared with volunteers who receive another vaccine or no vaccine. These results give researchers a better idea of how well the vaccine works and if there are possible side effects they should expect. The Food and Drug Administration, or FDA, along with the Vaccines and Related Biological Products Advisory Committee, review all of the data the researchers have gathered throughout the trials and decide whether or not to license the vaccine. Once licensed, vaccines are made in batches called lots. Manufacturers test the lots to make sure the vaccines are safe, pure, and potent. the FDA reviews the safety and quality of each lot before it is released. The FDA inspects manufacturing facilities on a regular basis to ensure quality and safety. How a vaccine is added to the U.S. recommended immunization schedule. Once the FDA licenses a vaccine, CDC brings together the members of the Advisory Committee on Immunization Practices, or ACIP, to review all of the research available on the licensed vaccine. The members of the ACIP include world-renowned vaccine and disease experts from groups like the American Academy of Pediatrics and the American Academy of Family Physicians, CDC, and other government agencies. These experts look at how well the vaccine works and whether it's safe when given to different age groups. They also weigh the seriousness of the disease the vaccine prevents and figure out how many children would get sick if they did not get vaccinated. The experts then decide if they should recommend that vaccine be added to the U.S. recommended immunization schedule. If the CDC approves the experts' recommendations, the vaccine officially becomes part of the schedule, and soon it will be available at your healthcare provider's office. How a vaccine's safety continues to be monitored. Once children start getting the vaccine, the FDA and CDC continue to watch for possible side effects. Reactions that happen after a vaccination get reported to the Vaccine Adverse Events Reporting System, or VAERS. Anyone can submit a report to VAERS, including parents, caregivers, patients, doctors, and nurses. However, the reactions that are reported may or may not be caused by the vaccines. They may require further investigation. Researchers at FDA and CDC analyze the VAERS reports and look for any trends that may be happening. FDA and CDC also use other vaccine safety systems. The Vaccine Safety Data Link, or VSD, and the Post-Licensure Rapid Immunization Safety Monitoring System, or PRISM, actively monitor new vaccines to obtain additional information about their safety. VSD has access to healthcare information for over 24 million people. PRISM can analyze healthcare information from over 190 million people. CDC also uses the Clinical Immunization Safety Assessment Project, or CISA, to study vaccine safety. CISA is a collaboration between CDC and 7 medical research centers. CISA vaccine safety experts conduct individual case reviews and clinical research studies about vaccine safety. Recommendations for using the vaccine may change if the vaccine's risks are found to be greater than its benefits. The end goal is always the same: to safely and effectively protect children, families, and communities against potentially serious diseases. For more information...
Okay. So I know that was kind of a lot of information and a lot of acronyms and organizations, but as you can see, there are several agencies watching out for side effects and safety concerns with vaccines. It's not just the CDC or just the FDA. There are several organizations that make vaccine safety their top priority. So when we talk to parents, we can reassure them that vaccines are safe and effective.
Please.
Okay. The next situation, mom and dad both think that vaccines are good, but that babies get too many vaccines in one visit and their immune systems are too new for so many. So we kind of got that question earlier today. So mom and dad plan to delay some vaccines and only get 2 at each visit. So what are some things that you can say to educate them and reassure them? You can feel free to put your answers in the chat if how you would answer this. But just as a point, getting childhood vaccines are not an extra burden on the immune system, even for babies. Babies are exposed to hundreds of viruses and bacteria during normal activities like eating and playing. And even though kids receive more vaccines, they receive far fewer antigens overall compared to their parents or grandparents. Our children are now protected against more diseases also. I have a short video clip. This is Dr. Paul Offit. He is a very well-known vaccine doctor and researcher, and he has a lot of great information to share and expresses it in a very clear manner, a lot better than I could. So we're going to listen to what he says about babies getting too many vaccines.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center here at the Children's Hospital of Philadelphia. The most common question that we get asked here at the center is, do babies get too many vaccines? It's an understandable question. In the first few years of life, babies get vaccines to prevent 14 different infections. That can mean as many as 27 inoculations during that first few years of life. It can mean as many as 6 shots at one time. And I don't care how smart you are about viruses or immunology, it's hard to watch your baby go through that. So the question is it too many? Well, so let's take a step back. When babies are in the womb, they're in a sterile environment. When they enter the birth canal and the world, they're not. And very quickly, they have living on the surface of their body trillions of bacteria. I'm not just trying to sound like Carl Sagan here, literally trillions of bacteria. You actually have roughly 100 trillion bacteria on the surface of your body. That's more than you have cells in your body. Now, each bacterium, each single bacterium has between 2,000 and 6,000 immunological components. Now, by immunological component, what I mean is the complex sugar that sits on the outside of the bacteria, so-called polysaccharide, or the proteins that make up the bacteria. Viruses also have proteins, and those are considered also immunological components. Now, if you add up all the immunological components that are currently contained in vaccines, it adds up to about 160. So think about that, 160 immunological components which consist of viral proteins, bacterial proteins, or bacterial polysaccharides, as compared to the trillions of bacteria, each bacterium of which contains 2,000 to 6,000 immunological components. So I think literally what you are exposed to in vaccines is a drop in the ocean compared to what you're exposed to in daily life. Frankly, I think a cut on your knee is a greater challenge to your immune system than our vaccines. I think the common cold, which can reproduce itself thousands of times in your body, is a greater challenge to your immune system than vaccines. So I think the short answer to the question, can babies tolerate so many vaccines given in the first few years of life, is yes. Because frankly, they encounter far more in their environment than they're ever going to encounter in vaccines. Thank you.
Okay, so Wendy, why don't you talk to us about this situation someone brought up already, autism.
Yeah, and actually before I get into this, I just wanted to, there's a really good discussion going on in the chat. And I have a personal story about the whole MMR thing. When I was pregnant with my first, they draw your blood and they do all these tests. I don't think I even knew what they were doing, but I got a call and they said, oh, your rubella titers are low. So as right when you have the baby, we're going to have to give you, you're going to have to get another MMR. And I was like, okay. But then of course I'm thinking rubella could be especially dangerous for pregnant women. So I'm thinking, oh my gosh, of course, my whole life I've gone without being exposed to rubella, obviously, because I feel like I would have gotten it since my titers were low. So now I'm like, when you're pregnant, you're scared of everything. So I'm like, oh no, now I'm going to be exposed to rubella. Of course, now. But I wasn't, of course, because everybody in the community was, kept me protected. So appreciate that. But no, literally as soon as the baby was born, she was getting her Hep B birth dose, and I got my MMR. I was still in the delivery room, so they were sure about. They knew, they had notes. They knew that needed to happen, and I got that third dose. So I think that there's a lot of good discussion in there about the nurses getting that third dose, and it must have worked, because for the next two babies that I had, I did not get any message that my rubella titers were low. So I just needed that little extra, I guess. Okay, enough of that. So this is our next scenario. A mom of a 13-month-old toddler is sharing in her mom's group that her baby is not the same as she was before her MMR shot. She's worried that the shot caused harm and wants to warn others about vaccines and autism. So what resources do you have available to help with their concern? What is something that you would say if you hear this? You can put it in the chat if you would like to. I think this is probably the most well-known myth about vaccines. Autism usually becomes apparent around the same age that the MMR vaccine is given. There's no causality. It's never been proven. Autism probably has multiple components, including genetics. And oftentimes these immunizations are timed at the same time that babies are changing quickly. I mean, every day is a new day with a baby. They change so fast. They learn to crawl, walk, and talk, and they're developing their own personalities. Sometimes it feels like toddler crawling on the table and saying no to everything is unrecognizable. Just because things are happening at the same time doesn't mean that one thing is causing another. I like to quote the immunization medical director. She said, if you get gas in your car and then you get a flat tire, the flat tire was not caused by you getting gas. You just happened to do it at the same time. So the correlation does not equal causation. That's a lot of things that we say. There have been multiple studies into the claim that autism that vaccines cause autism, and it has never been proven. So that's really important. And now we have another this is a really great video by Dr. Offit, who will explain this much better than I did.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. I think probably one of the most common concerns parents have about vaccines is, do they cause autism? Certainly very easy to find that contention on the internet and in chat rooms, so it can be scary. And I think from the parent standpoint, they argue this: look, my child was fine, they got a vaccine, now they've developed signs and symptoms of autism. Could the vaccine have done it? Well, the good news is that's an answerable question. And it's really been in three different areas that this issue has been raised. One is the concern that the combination measles, mumps, rubella, or MMR vaccine caused autism. The second is the notion that there was an ethyl mercury containing preservative that was in a number of vaccines. Now it's only in some multi-dose vials of influenza vaccine called thimerosal. And then the third sort of concern is that children are just getting too many vaccines too soon, that that's somehow weakening or overwhelming or perturbing their immune system. Well, these are studyable questions. You can answer this question. So, for example, in the case of measles, mumps, and rubella, there now have been 18 studies done in 7 different countries on 3 different continents involving hundreds of thousands of children who either did or did get the MMR vaccine, making sure that those two groups are otherwise similar with regard to their healthcare seeking behavior, their socioeconomic background, their medical background. And again and again and again, those studies all found the same thing, that the MMR vaccine did not cause autism, and that's been true also for these other two concerns. The good news is I think most parents get this. I think most parents believe these studies because a recent study by the Autism Science Foundation found that about 85% of parents of children with autism now are comfortable that vaccines weren't the cause. Thank you.
Did you have any follow-up comments on that, Wendy?
No, I think he does a really great job. And again, I think this study has been debunked so many times, but it got big celebrities behind it. Jenny McCarthy was all about it. So it got a lot of attention, and it has been super harmful. So yeah, I think this is something that people still hear when they're talking to families and parents about vaccines. Is this something? I know we had a question about that earlier in the chat. So I just, is this something that people are hearing a lot about still? You can just say yes or no in the chat if you want, or if you have any stories. It's so, like, as Denise said, so much money has been spent on this, money that could have gone towards autism research instead of vaccines. So, well, that's good. Not as much as a decade ago. That's good, Elizabeth. But yeah, it's still out there. Okay, that brings us to our next scenario. A family you're working with just attended a chickenpox party so that their kids have a chance to get the disease and boost their immune system. They want to know if chickenpox and measles parties are a good idea. So how would you answer that? What are some resources that are available to you to help with that? These are a few things we can say. Infection usually does cause better immunity than vaccination. That's something that we know. However, the price paid for natural disease can include paralysis, permanent brain damage, liver cirrhosis or cancer, deafness, blindness, pneumonia, and even death. So, are you willing to risk these things for your child when there's a much simpler way, much less painful way of getting immunity? My whole family has been vaccinated against the flu, but it came through our house several weeks ago, and I hated it. I hated seeing my children sick. And it was their symptoms weren't as bad if we did not get the flu vaccine. And they really they're so resilient. They bounced right back. But what if they didn't? Do you want to risk that with your children? And that's kind of how I explain it to people. You never know if something if the consequence is going to be much greater than just a few days of a fever, which is still bad. And we have one other thing I wanted to kind of mention is when at the beginning of the pandemic, before there was a vaccine, there were also those who talked about having COVID parties, and then you saw it in the news. People were having COVID parties, and I wonder what those people feel like now, knowing that you can get COVID more than once. And was it worth that in the very beginning when so little was known about COVID and how to treat it, and there weren't antivirals or things like that, but people died as a result of those COVID parties. So that's something that you always have to remember, that you never know what's going to happen. And then, Dr. Offit has another great video explaining this as well.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. One question parents reasonably ask is, isn't natural infection better than immunization? Well, I'm a man in my 60s. I was a child in the 1950s. I had measles. When I had measles, I developed an antibody response that is probably threefold greater than what children will get if they get a vaccine. But what I didn't have to suffer by being naturally infected was I didn't get pneumonia, which could have caused me to be hospitalized. I didn't get encephalitis or infection of the brain, and I didn't die. Every year in the 1950s, everyone got measles by the time they were 9 years of age. That meant that 3 to 4 million people every year would get measles. About 48,000 would be hospitalized with pneumonia or encephalitis, and 500 would die. Fortunately, I wasn't one of those people, but I could have been. So the better question isn't, is natural infection better than immunization? The better question is immunization good enough? Can immunization induce an immune response that's good enough to prevent and arguably eliminate these diseases? Well, we have the answer for measles. When we had a second dose measles vaccine recommendation in 1991, that meant that all children in this country were recommended to receive a measles vaccine when they were 12 to 15 months of age, and again at 4 to 6 years of age. With that, we eliminated measles from the United States, eliminated it by the year 2000. The only reason that it's come back recently is that a critical number of parents have chosen not to vaccinate their children. So I think the good news about the measles vaccine is it induces an immune response that's good enough to have eliminated that virus from this country without asking children or having children risk the severe and occasionally fatal effects of a natural measles infection. Thank you.
Okay, so I want to talk for a minute about how to find reliable resources. It's very important that you know where you can find reliable resources. Find out which apps, websites, books, videos are from trusted sources. We have this handout available on our website, this reliable resources. It lists a lot of different websites, videos, books for parents, great things that you can give to parents to recommend. If they have questions about vaccines and they want to know more about it, these are all great information. As Denise said earlier, all of the videos and links and handouts, that's all available on our website. And I'll be sending it in the follow-up email also. These are two of the best sites to access valid and reliable information about vaccines. We heard a lot of videos from Dr. Offit. He is with the Children's Hospital of Philadelphia. And then also the CDC has many, many different pages on every different vaccine and disease. And it's always a very great place to recommend. And of course, overall, you can always refer to the person's medical provider for any additional questions. Now, we kind of talked a little bit about tough questions that you may hear, and we created this little cheat sheet. So common questions that we talked through, tough points of vaccine conversations. We created this handout and it is available on our website also. This is TAPI's website, whyimmunize.org. We have a lot of flyers and handouts and all kinds of things that you can use in your job. And also, if your sister-in-law is asking specific questions about something, it's good to have some resources available. We also have a lot of flyers and vaccine schedules, things you can hang in your office. We have a bunch of school nurses that really love this poster here, how to stop the spread of germs. So it's very important in a child care setting. Just a friendly reminder, cover your cough, don't come into the school or childcare when you're sick, all of that. Also flyers about, what vaccines will be needed as you go off to college, HPV vaccine, all kinds of different flyers. They're available on our website for free. If you are someone who sees a lot of parents and you would like a stack of these flyers, those are still free. So you can order them on our website and we will just ship them to you. And there's many more flyers not even displayed here. So lots of resources. If you are interested in adding your logo or brand to these, we are happy to do that for you. So we love to co-brand. Here we have the State Health Department is on this one and lots of different people here. Let's see. So thank you so much, Wendy, for presenting with me today. We love to give out prizes. We gave out some today, but you still have the opportunity to win another prize. We have an evaluation. So please take the evaluation. Denise will post it in the chat. Your feedback helps us improve future training. So we would love to hear what you liked about the presentation today, what you didn't like, anything we can improve for next time. We will send out several prizes for that. So make sure to fill out the evaluation. And if you have any questions, I did make a note. I wanted to explain what the Pink Book is. So I did get several requests already for a Pink Book to be mailed to them. So I will get on that. But the Pink Book is literally a pink book. It's like a textbook size. It is all about vaccines and different diseases. So it talks it's like a very general, kind of like an encyclopedia where a lot of great information about different diseases, the vaccine information sheet, how to administer the vaccines, correct dosage based on different ages and heights and weights, all of that. So that is what a Pink Book is. And if you would like one, please email me. I will definitely get that sent to you. We have several and we give them away a lot. So please do that if you would like one. And then if you are a social worker, a certified health education specialist, or a registered nurse, you can receive CEUs for today's training. So there is a link that Denise will post in the chat also. And just a note, you must be present for at least 90% of the live training to receive those CEUs. Okay, how is this chat box looking? Did Denise get through everything? Okay, more requests for pink books. Excellent. And you can email me if you don't want to put your address in the chat. I will have access to it both ways. Thank you so much for all the comments today and all of the ideas of how you would answer questions. We really appreciate that because we learn from each other and we can help each other. So that was fantastic. We have just about 1 more minute. If you would like to put any last questions in the chat, we will try to answer them. Veronica is asking about CEUs for certified medical assistant. No, we do not have that capability yet. It has been on my list for a long time, but it just did not line up with the training. So I will revisit that because we do have a lot of medical assistants attend. Some programs do accept a certificate of participation. So it depends on your medical assistant certification. We do offer certificates to anyone that would like one for today. That's just like a general, you attended today and here's your certificate. Sometimes that's helpful for professional development hours based on your organization or like a certifying body. So it really is kind of dependent on each individual person. So we're happy to offer general certificates. Let's see. Any other questions? Anything you want to add, Wendy?
No, I think we had some great discussions. So thank you all for using the chat and putting in your questions. Hopefully we answered all of your questions. And I'm sure we didn't because there's got to be a lot of questions out there, but know that Tappy's a great resource for any of those questions. So feel free to reach out if there's something that we didn't answer today.
And thank you to Denise. I know there's a lot of questions. I appreciate you keeping up with all of them in the chat. She is a wealth of knowledge, so that is great. Sounds like we need to send out a general certificate to everybody. So that's good to know. Usually we have you fill out the survey link for CEUs, but I think we can probably just do a general certificate also. Okay. And make sure you take that evaluation link on the training itself. That would be great. Okay, lots of requests for certificates. I'm not seeing any additional questions. Yep, so Tappy has a web page where the recording of the training today, as well as the slides, videos, handouts, everything is on our website. I will send that in an email to you so you have access to it. Please email me for a pink book so I have your address of where to send it. Put my email here. We offer this training quarterly, so if you have a coworker that couldn't attend today, or if you want to join us again in 3 months, it'll be the beginning of May. So you're welcome to come back for that. Okay, thank you so much, everyone. Have a great day.